Welcome. I'm Donald Stull. I'm head of data analytics and design strategy at RTI Health Solutions in Manchester, England. I live in England. I'm not from England. You can tell by my accent. I'm an American who's been transplanted for quite a few years. I'm going to be talking about CSU from the patient's perspective. What do we know and how can that help in treating patients and understanding their particular circumstance? These are my disclosures. So, as we've seen, chronic spontaneous urticaria, according to the treatment guidelines and healthcare professionals, is a function of itch, hives, angioedema, and some combination, as we've seen in the previous discussions. And while those may be the kinds of things that patients will present with, that a physician will focus on, for the patient themselves, it means something much more. As Clive had mentioned, we see that patients report loss of sleep, a sense of distress, depression, embarrassment, an impact on their daily activities. Well, if we're going to try to understand that from the patient's perspective, what's the best way to gather that information? And that's through the use of what are called patient-reported outcomes. These are increasingly recognized as a valuable component for diagnosis and for determining treatment regimens for patients in a variety of disease areas. It's important because it provides the patient's perspective on their symptom severity and the impact of their symptoms on their lives and the quality of their lives. So let me ask you, get your voting sticks handy. How often do you use some kind of patient-reported outcome to measure the patient's perspective when they present to you with urticaria? And at the bottom of this slide, you see some of the common measures that are used, patient-reported outcomes measures that are used to study the impact of CSU. Right? So, vote away. Never. Well. We have a not insubstantial number of responses to 5 that there is no access to PROs. We had wondered about that. If you don't have access to them, you don't know how to obtain them, how to use them, then chances are you're not going to. There's a sizable number of people who use them often and always. So that's interesting. What we'd like to do is see if there's some way that we can move those of you in category 4 to something a little bit more frequent. So the rest of my presentation is going to talk about the value of patient-reported outcomes. What are they? What are some of the PROs that have been used in studying urticaria? And how do we interpret those PROs and make sense of them, both in terms of understanding from the patient's perspective the impact of urticaria on their quality of life, but also in making decisions about treatment. The FDA has produced a guidance in 2009 after a great deal of discussion and input on the use of patient-reported outcomes for labeling claims. They define a PRO as a report of the status of a patient's health condition that comes directly from the patient without interpretation of their response by a physician or anyone else. So the key here is that we are trying to understand what it is about the patient's experience with a particular disease from them, using their words and their descriptions. Now, for something like urticaria, as with a lot of other conditions, there are certain parts of it that can only be obtained from the patient, things like itch or things like pain. But in addition, things like health-related quality of life, adverse events, or treatment satisfaction or preference for certain kinds of treatments can only be obtained directly from the patient. So when we're interested in trying to understand concepts that are of central importance to patients, a PRO is advised for obtaining this information. Health-related quality of life itself is a multidimensional concept. There are lots of different aspects to health-related quality of life, such as physical domains, emotional domains, physical performance, and so on. But the health-related quality of life is itself one of many domains that are all combined into making up our quality of life. The health-related quality of life, and hence overall quality of life, is, as you can see, affected by the treatment, the symptoms that the patient experiences, the treatment that is prescribed to deal with those symptoms, and any sort of disabilities or functional impairments that result from the disease. International Urticaria guidelines recommend the use of PROs for understanding disease activity and understanding quality of life for patients with CSU. So in a formal statement then, they recognize the importance and the value and the meaningfulness of patient-reported outcomes. Well, here's a fairly lengthy list of different kinds of patient-reported outcomes that have been used to measure the effects of urticaria on patients. There are three different categories here that we'll talk about briefly, and then some of these we'll focus on more in detail. There are those that are urticaria-specific in the first box. There are those that are more dermatologic, but not necessarily specific to urticaria, but still have application. And then those that are more generic measures of health and health states. The ones that are highlighted in red are the ones that have been used in recent phase 3 clinical trials of omalizumab, and they will be the ones that I'll be focusing on for the duration of my presentation. We have two that are urticaria specific, one that is a dermatologic, and one that is a generic questionnaire. Let's start with the first one. The weekly urticaria activity score is a disease-specific patient-reported outcome, and is designed to assess itch and hive severity for patients with urticaria. It's two questions that asks the patient to rate either once or twice a day, depending upon the form, the severity of their itch and the number of hives. Those are summed up over the course of 7 days, and then this creates what's known as the weekly urticaria activity score, or the UAS-7, which, as you can see on the right of the slide, ranges from 0, no itch, no hives, to 42, which is pretty severe. Just one quick note, because it's two questions, it's very easy. Doesn't take a lot of time for patients to complete. And one of the things that I'll be pointing out as we move into some subsequent slides is you have two questions asking about these signs and symptoms. How do those relate to more multiple item questions that assess health-related quality of life? The UAS-7 has recently been categorized into 5 health states that you can see on the slide here. To some extent, they were logical categories based upon certain aspects of the clinical trials. For example, patients were included in the trial if they had a UAS-7 score of 16 or higher. The two bottom categories, 1 to 6 and 0, represented secondary key endpoints for the trials. And the others, 7 to 15, became a kind of residual between those two. And as I understand it, Dr. Gautain, you can clarify as needed, 28 became a key criterion and cut point, particularly in the UK, for prescribing. We have been doing some validation work on this. Some preliminary work on it was presented earlier in the year at EACI. We're continuing to do work on these health states to show that they are meaningful and they discriminate between different levels of patient severity. The second urticaria-specific measure that's been used is the CUQ-2OL. This is a patient questionnaire that was designed and validated for the assessment of quality of life for patients with urticaria. It's 23 questions that cover 6 key domains that include things such as the physical, psychosocial, and practical aspects of the condition. The dermatologic measure that was used is the DLQI, and I'm sure a number of people in the room are familiar with this particular instrument. This is a validated questionnaire for evaluating health-related quality of life for patients in a variety of skin conditions, including urticaria. There are 10 questions, and these are subdivided into 6 domains. And finally, the generic measure that we used for these analyses and that were included in the trials is the Medical Outcomes Study Sleep Scale. This is 10 or 11 questions that asks a number of aspects of sleep, and it taps into 6 theoretical dimensions of sleep, and we focus on 2 of them for the purposes of today's presentation. You can see the design of the 3 trials here. You can see where the DLQI, CUQ-2OL, and the MOS sleep items were assessed, where the gold stars are. The UAS-7, as I mentioned, is a daily diary, so it's collected every day, summed up over a week, and then we use the scores at every 4-week period that you see where the red stars are. And you can see where the primary endpoints at week 12 are for the trials. At baseline of these trials, the disease burden for those patients with inadequately controlled CSU was relatively high. You can see the mean UAS-7 scores, 30 out of 42. Even when patients had to have a minimum of 16 to come into the trials, the fact that the mean was 30 says that there was a fair degree of severity for these patients. For the others, the scores you can see on the slide here. I just want to provide a little bit of context, particularly for the 2 MOS sleep scale items, the somnolence scores and the sleep disturbance. While those are 40 and 47 out of 100, may not seem particularly high, for most other conditions, we just don't see patient scores approaching 100. So these still indicate that there is a fair amount of somnolence and sleep disturbance for these patients. This is an example of the UAS-7 scores for the 300 milligram, the treatment arm, and the placebo arm for one of the trials, Glacial. And you can see what happens for those patients on treatment. There's a fairly significant decline in their UAS-7 scores. That is, they're showing a pretty substantial improvement in the first 4 to 6 weeks. It stays relatively steady until treatment is stopped, and then the scores start to go back up, indicating that their signs of and symptoms of severity are getting worse. Still, they don't go back up to the baseline score at the end of the trial, which is important to note. This is an overview slide, and I'm going to go through each one of these graphs, but the basic takeaway message here is that when we look at changes in the Urticaria Activity Score, the weekly score, the UAS-7, and compare it with changes in the other PROs, there's a high degree of correspondence between what one PRO is telling us and what the other PROs are telling us about the changes in the patient's condition. Let's take a look at this particular one, for example. This is the relationship between the change in UAS-7 and the DLQI over 40 weeks for Asteria 1. Now, the correlation between those two changes is 0.94. it's almost a perfect correlation. So what this is telling us is that when a patient's signs and symptoms of urticaria, as measured by the UAS7, show improvement, then their reports based upon the DLQI are also showing comparable improvements. If we look at the same sort of relationship between the UAS7 and the CUQ-2OL, a disease-specific quality of life measure, we see a similar pattern. Again, a correlation of 0.94. They're almost perfectly correlated, so that when we know that a patient's improving in terms of their signs and symptoms, then they're showing a comparable standardized amount of change in the other PRO. So the simple two-item measure of the UAS7 and the multiple item measures of the DLQI and the CUQ-2OL are giving us some very comparable information, nearly identical information, about the changes in the patient's condition. When we look at the relationship between changes in the UAS7 and daytime somnolence, the correlation is not as high, but it's still high. It's still strong from a statistical standpoint, 0.67. So even though not all patients are going to experience daytime somnolence because of their urticaria, it may not bother all of them at night or bother them enough that they're sleepy during the day, we still see that when their signs and symptoms improve, then their daytime somnolence improves. Likewise, for the final comparison between the UAS7 and sleep disturbance, the correlation's not quite as high as the last one or the first two, but it's still moderate. If we see a correlation between two things of 0.5, that's still a pretty sizable correlation. So improvements in their signs and symptoms show that there's also a corresponding improvement in their sleep disturbance. So now that I've presented this, especially for those of you who responded, I never use a PRO to evaluate or get a sense of the patient's experience, you might ask, which of these PROs should I use if I'm going to use one? Well, as you've seen, there are numerous validated patient-reported outcomes measures that are available for use. We've presented 4 of them that have been used in the phase 3 trials. The preferred choice can be based upon your familiarity. It can be based upon whether you're trying to understand signs and symptoms, health-related quality of life, or any number of decisions. But what's interesting from these results is that when you look at changes in signs and symptoms, as measured by the UAS7, these are mirrored very well or nearly identically by the changes in the CUQ-2OL and the scores in the DLQI. And so the UAS7 and the CUQ-2OL and the DLQI are going to give you comparable information about changes in the patient's condition and whether treatment seems to be working. And as we saw, the UAS7 is also correlated with the generic measures of sleep outcomes. So if a daily diary is not convenient, but you want to get a sense of the patient's condition at the time that they visit, then you have the option of the DLQI or the CUQ-2OL. They're going to yield comparable information about their condition over a prior period and be able to see whether the condition's improving. International Urticaria guidelines, as we've noted, recommend the use of PROs for understanding disease activity and the impact on quality of life. We see that the use over the last 10 years of PRO data in label claims has increased. If we look at the period from about 2004 to 2012 and compare that with the previous 8 to 10 years, there's been almost a doubling of the number of claims that have been obtained through the FDA based upon PRO data. This is patient-reported data. So clearly, patient reports are of value for making claims about efficacy and safety of treatments. So they have value for label claims. They clearly are telling us something about the changes in patients' trajectories of their disease. And the PRO can add information about the patient's perspective to disease management. How are they feeling? Are they feeling better? Is it improving? And this can provide some information to help clinicians understand whether the treatment that the patient is currently getting is successful or if some other treatment regimen needs to be employed. So now, get your voting sticks handy. Would you consider using a PRO to measure the patient's perspective in urticaria? Has what I've mentioned to you in these slides given you at least some reason to think that maybe it would be useful, worthwhile, interesting to use a PRO? All right, vote. Wow. I'm impressed. Are you impressed? We're impressed. That's great. Please do. Continue to use, start using them, continue to use them. They are informative, as you've seen. Thank you very much.